Welcome back to our interview with Dr. Kenneth Iserson, author of Getting into a Residency, A Guide for Medical Students, now in its 8th edition. Dr. Iserson, how can residency applicants best prepare for their interviews?
Jen, the most important thing is for the applicants to listen to the questions very carefully. Answer the question that was asked briefly. And if the interviewer wants more information, they'll ask a follow-up question. Don't ramble. And if the interviewer wants to talk about subjects that are particularly interesting to him or her, maybe something that was brought up in the conversation, let them talk. That's a winning interview.
What types of questions can they expect?
There are 3 general types of questions: simple, open-ended, and probing. Simple questions require specific answers, such as, when did you graduate from high school? Open-ended questions require a more complex answer about yourself or your attitude, such as, what clinical experiences have you had in this specialty? Or what do you think of physician advertising? Probing questions are the follow-up questions. Why do you feel that way?
What are the most common questions they may encounter?
The most common questions that applicants are asked, surprisingly enough, are, do you have any questions? Usually from unprepared interviewers. Tell me about yourself. Potential mine shaft to fall into. What are your strengths and weaknesses? And why did you apply to this program? In general, physician interviewers are not that good at doing applicant interviews, although they're excellent clinicians.
Are there more unusual questions they should be prepared for?
Examples of some of the less common questions that applicants may encounter are, what do you think of what's happening in the economy, the Middle East, Congress? Meaning that you better know something about current affairs. Can you teach me something in 5 minutes that's non-medical? Can you think on your feet and be interesting? And also do a little teaching. What problems will our specialty face in the next 5 or 10 years? Do you know anything about our specialty? There's lots more, and we don't have time to go into it. The questions of this type and the answers are described in the book.
Do you have some final interview tips for applicants?
Applicants should sell themselves. Tell interviewers why you're the type of applicant who they want as a resident. On exiting from each interview, shake the interviewer's hand firmly, smile, and say that you hope to be part of their program. Then smile and be positive as you make your way to the next interviewer.